sponsored by Sophie and Toffee. Use code NERDY10 for 10% off your subscription. Welcome to episode 4 of doing things for the first time I probably have no business in doing, but I do it anyways because I wanna. That about sums it up. Today we're going to be trying suturing kit for medical students. We're going to perform minor surgery. Oh, why do I do these things? My guess is as good as yours. Or your guess is as good as mine. Same thing. Two brains of the same... Great minds think alike. So yes, today I got a suture kit for medical students from Amazon. I got this idea from a previous video because a Karen did complain that I did tattooing for the first time and then sarcastically asked if I was going to end up doing some kind of piercing, which we did. And then the Karen also asked, scarifications, but I'm not gonna do that. So the next best thing is fixing scars. I have a really bad history of really messing up any kind of sewing or anything textile, like this poor little squirrel made out of felt or chipmunk. We don't even know what it is, but it has some really awesome eyebrows. Or even the time I rage quit trying to do an amigurumi of Disney crochet.
In the trash!
So it's gonna be interesting to see if I can be your doctor. Can I mend you if you got a gash or something? As a little grain, I visited the hospital quite often because I was the adventure grain that climbed trees, knocked my head accidentally on metal poles. So yeah, I have sutures, I have battle scars. I am a warrior. Look at me. I have my warrior sword. I have a nice goatee because that's what warriors have. And because I'm extra, I brought ketchup. No other reason than to see if I can do this properly without being too messy is the idea. So yeah, welcome to this adventure with me. And if you're new here, make sure that you do subscribe because I wave sharp pointy things, which you will end up liking anyway. So click on all notifications while you're there because it's our thing. And I have to say, I had so much fun learning how to pierce, and trust me, I saw all the comments telling me that the red flags were basically using that machine to pierce with. Yeah, that thing, as you can see on the screen. But I didn't know that. So I'm excited to hear about you and your methods about suturing things. So you know what we gotta do? We gotta see what's inside it. I mean, it can't be much more difficult than actually sewing clothing, right? Maybe it's even easier. I don't know. We're gonna learn. Interesting. Interesting. Oh, so fancy. Look at that. Call me Dr. Jackie. Oh, hang on. I need to be fancy here. Okay, I have my glasses on. I'm a doctor now. Here's a stethoscope in my background because I want to be professional. Can you tell me what happened? I didn't hear anything you said, but I'm just gonna give you Tylenol. So we're going to be also looking at the tutorials that come with this kit. So we have a bunch of stuff here. Not sure what that is. It seems like it's filament. And then the actual kit. I really hope we do get the needles so that we can sew, but I guess we'll find out. And, ooh, yes! Okay, the needles are here. We get a bunch of scissory things, tweezer things. And here is the thing I am most excited about, which is the fake skin. Oh my god. Oh, that is solid. Oh, that is weird. Oh, yeah, that feels very skin-like. Just like someone's feet when they're cold. Kind of like my feet right now, because it's cold in this room. Canada, the land of the frozen feet. So, as you can see, the actual fake skin has some sort of texture right there. And then we have different kinds of openings. I don't know what the situation is. I really hope that the tutorial videos are going to tell us what each one is supposed to mimic. And we have these Y shapes, we have openings, and these are probably the ones I had to get sutures for most of my childhood. And then we have really big ones. So we really are going to try and close these up as best as we can. And I did have knee surgery, so I do know what the scar looks like and the sutures. So I'm definitely ready for this. All right, let's play around with these scissor things. And, oh, it's kind of like the scissors that we used for piercing to hold things down. It has a locking mechanism. Look at that. So depending on how tight you want it, it has these hooky things that you could just use and decide how it holds. This might come in handy. Since I'm doing these alone, these could be the other hand to hold stuff. Next one here. This is a little bit more of a bent type of scissor, but also, I'm calling them scissors, but they're not really scissors, I'm sure. Stop yelling at me through the screen. I can hear you all the way to Canada. Stop. I know. I know I'm messing this up, but I'm learning. I'm going to condense 7 years of medical school into a 30-minute video, or however long this video is, because I'm efficient. So basically, yes, we have these hooky things again to hold things in place. It's crazy how tattooing and piercing are teaching me basic things about medical school too. It takes professionals to do these things. Don't do this to yourself. If I have to put warnings on every one of my videos because Karens aren't happy, don't suture yourself, okay? I'm a professional moron doing this on things that don't really matter. Like fake skin, okay? We got this out of our system, just don't do it. Next we have tweezer thingies. But these are like Tyrannosaurus tweezers because they have jaws and they have like teeth. And I like this grip thing, it feels nice. Now these, I'm pretty sure, are actually scissors. Look, there's no hooky things. And it goes here. And lastly, what are you? What is this? What the heck? What is that? I don't know. And here we have a carbon steel surgical blade. It says surgical blades, plural. So I don't know if there's multiple in here or is each one different. We're gonna take a closer look at this. So we're gonna have a cooler concept of what these are. We're gonna open it in not too long. Just be patient. This is fancy. I want to put my clay tools in here. And then in here, I like that they're giving us resealable bags. It's interesting that they don't even give us gloves. I mean, even the tattooing kit and the piercing gave us gloves, right? Yeah, but surgical students, they don't need it. So we have polypropylene monofilaments, I guess like fishing net, fishing wire. And then we have polyester braided, kind of like floss, I think. And silk braided, I think that's also like floss. And then we have nylon monofilament, which I don't know if it's similar to anything. We're gonna look at all of these and find out exactly what the difference is. But before we do that, let's look at some of the video. I'm really curious what the video is gonna be. Do we have an introduction? Does it tell us anything? That's gonna be cool. Alright, so I pulled up the introduction video to this kit, which is a different doctor, at least it seems so, from this guy over here, who seems like he would just not listen to what you were saying anyways. So this guy already looks somewhat friendlier. Let's see what he has to say.
Hello everyone, my name is Dr. Mario Ademai, and today I'm going to be your instructor in the How to Suture course.
Very nice. So we're actually going to get a whole course. That's good value. For only $50, I can learn to suture. That'll come in handy during the zombie apocalypse. Well, if you get bit though, I can't help you. Get away, zombie, it's not your time yet. We're still September, wait for October.
These suturing kits have everything you need inside.
Did he just say includes everything you need? I mean,
includes everything you need.
Which so far it seems so, except for the gloves, which should be, in theory, way more important in the medical field than any, actually they're all very important. Anything that has to do with touching bodies should be good practice. I need to remove these. We're not joking no more. Look, just listen to what I say, not what I do.
If you guys have any feedback, always feel free to let us know so that we can improve our services and products.
That's really cool. I haven't heard a doctor say, please let me know so I can improve. They're like,
I am superior.
if you are a doctor watching this, I am sorry, but I've just had bad experience, so I'm 100% projecting. Maybe you're not like that, but I've had to deal with it a lot with my medical issues. Don't take it personal. Alright, so this one here is the introduction of the material, and it clearly says not to use on people or pets. As I said at the beginning of the video, don't do it. Okay, even they said don't do it.
Alright everyone, so we're first going to start by introducing you to some of the tools and equipment that is found inside of the A+ Medics kit.
Please, yes.
So first we have the suturing board with the soft material on top.
Oh, look! He's wearing gloves that were not provided. So, hey Mario, since you're passionate about projects and things being good, I guess add gloves. I do have my own though, but just in case. For good practice.
And now we're going to go over each of the instruments just so that everyone is familiar with each one.
Excellent.
First, on the right hand side, we have the scalpel holder and some scalpels right next to it. We'll talk.
Wait, scalpel holder? This thing? Oh, I get get it. It's so you can put your sharp pointy things in there. Okay, I'm teachable. I've already probably shaved off 1 whole year of med school. This is great.
These are the scissors that can be used to cut through the suture material. When you're cutting the suture material after a knot, you want to go in at it straight 90 degrees and then slant it slightly sideways, just so that you can leave a little bit of a room on the suture material.
Okay, so we have to go into 90 degrees. Very nice. I hope you grains are learning something too.
Next we have the needle driver. So this is obviously the most important tool when it comes to suturing. This is what you hold the needle with. You put your ring finger and your thumb through the holes and put your index finger at the top to apply the pressure and help you guide it.
Oh, okay. So we absolutely have to use those scissory things with the clamps in order to hold the needle. So we're not actually holding the needles with our hands. We're using a kind of plier thing to go in and out. That's going to be interesting and challenging.
Next we have the curved forceps. The curved mosquito forceps can be used to hold the sutures together, the strings together, or just to clamp down on anything that you need to clamp on.
Okay, so the curved ones, this one here, is basically to hold anything else but the needle. So you can basically hold the skin or anything. Good, okay, we're learning.
Next we have the gripped forceps. These toothed forceps are used really to apply pressure on the skin, which will help drive the needle easier through the skin.
Okay, the T-Rex ones are made in order to just basically hold the skin. Good to know.
Alright guys, so now I'm going to demonstrate how to be able to safely take out the needle from the package and place it onto the needle driver.
Okay, so the needles are in here? Yeah! Okay, I can feel a metal thing inside. So it seems like this one has a curved kind of needle. Same here. I think all of them do. I honestly have no idea what the differences are, so let's just continue listening to Mario.
So first, you're going to look at the type of suture material that you have and the size, remove the outer packaging, and then you want to tear the slit at the end of the package to be able to take out the actual needle itself. The needle is covered by this paper-like material, so you want to open that up. And then what I do once I have it open and exposed is I actually use the needle driver directly to adjust it onto my needle driver.
Okay, so we're gonna need our needle driver, so which is this thing here, the non-curved thing, scissors.
You're gonna see how I angle the needle on my needle driver. I like to grab it about 1/3 of the way from the suture material.
Wait, what? Does the filament already come attached to the needle? Oh my god, that is gonna help save so much time. I mean, can you imagine doctors doing this? Pretend this is a needle, pretend there's a string in my hand, and they're doing this during a surgery. Son of a biscuit. It actually would make a lot of sense. You know what? I kind of want to just open it and find out right away. We'll look at the rest of the tutorial later. Okay, let's open. Okay, here it is. Everything is so sterile. And nice. From here. Okay, so it's like, what? Okay, here it is. It's so tiny. Oh my god. Look how little it is. And yes, it's actually already in there and I don't have to worry. So from what it looks like, I really don't need to worry about it coming off at all. That makes a lot of sense. I legitimately thought we had to thread the needle and then constantly worry if it's gonna come off, then I have to push it back in. Can you imagine though if you had to push it back in as you're suturing? Tastes like ketchup. You just put it back into the hole. That makes so much more sense. This is fascinating. Oh my god. All right, what did Mario say about holding it?
And I also like to angle the needle about 100 degrees, not 90 degrees, not perpendicular to my needle driver, but about 100 degrees because it gives me a nice smooth bite whenever I go through the skin.
Okay, so he said about 30% away, like so. So not 90, but 100. In which direction though? I'm guessing like, no, the other way. There we go. Oh, that feels nice. That's a really good grip. Okay, so like so, like this. Okay, I think I get it. I don't know if you grains can see it, but it is pretty long. All right, let's go ahead and start. Before we go on, let's talk about today's sponsor, Sophie and Toffee. For those of you who don't know Sophie and Toffee, they are a monthly subscription box of fun resin crafts. So if you've ever been unsure about resin crafts, signing up for about 3 months of Sophie and Toffee will give you a good rounded idea of what you're going to get into. It's fun crafting, let me tell you. And with their new website that's super cute and easy to navigate, you're sure to find the new discounts that they have for prepaid months. In every box, you're going to get everything that you need in order to make projects and exclusive molds that were designed and created by Sophie and Toffee themselves. Let's make something with our fairy box. Cute fairy charm, resin, colorant, mixy in the mold, and shine. Now we're gonna do the same thing for the other two colors. And let's add brown and a cute glittery background. Oh my god. And time for the best part, which is unmolding. And oh my god, that is so cute. And if you place your order now, you're going to be getting the October box, which is the Crystal Druzy. So be sure to check the link down below and use the code NERDY10 to get 10% off your subscription box, but this deal is only available for 1 week. Thank you, Sophie and Toffee, for being huge supporters of this channel and for sponsoring today's video. I have my box of gloves. I don't know if these are gonna be too small, so I might have to get the bigger ones. These are basically Sika. My sister, this is what she looked like. You could see her on the screen. She has small hands. I got them sausage fingers. Let's see how this works. Oh, well, I guess not. You know what? Let's try. I think this is where I'm supposed to not try this again. Yeah, my fingers are just not having it. Okay, let's try the bigger ones. All right, so these are extra large, if I'm not mistaken, and they do feel good. I know someone's gonna say,
But Jackie, they're way too loose.
but stop. I like my gloves, like I like my schedule, loose and undefined. Now, one of the things Mario didn't say is to disinfect the area, so I guess we're going to go under the assumption that it's already disinfected. So let's go ahead and start with a gash that's simple. Oh my god, hang on. Now I'm stressed. I'm like, I got this, and now suddenly I'm very stressed. And we're gonna go ahead and do the first grab, which is basically with the T-Rex things. We go poke it there. Oh, I have goosebumps. Oh, my heart. Oh, that felt like skin. Oh, I don't like this. I'm gonna do surgery. Oh, thank goodness I didn't listen to my dad. My dad watches my videos. So, Dad, I am really glad I did not listen to you to become a doctor, because I'd be fainting right now. 100%. Okay, and we're gonna go right across. It's interesting because I can see the needle somewhat transparent under the skin here. Look at that. Actually, let me zoom in, and there's a little bit of transparency right here. So let me just grab the skin and poke right through. So I can basically see where it's going. This technique is really good. Mario, you are a great instructor. All right, so we're gonna pull the thread through. Oh my gosh, this is so long. Ah, come on. You can see the thread is still moving there, and my arm is just going so far. Okay, there we go. We got it. All right, so here's the part where we're going to learn how to make a surgeon's knot. And Mario, tell us.
So first start by driving the needle in, try to go perpendicular to the skin, and then take a nice smooth bite towards the other side, pull the needle out, and then pull the string all the way until you have a short side and a long side. Wrap around twice for a surgeon's knot. Then pull the short end and then pull your hands on opposite sides just like that.
Okay. I get it. I think I get it. All right, so according to the video, I'm going to make 2 loopies. 1 loopy, 2 loopy, and then grab this wire here. Okay, got it. And pull. Oh, hang on. We have a loop. Okay. Yes! And here is our first knot. That is so cool. And now what?
But this time you only do 1 throw around your instrument and then grab the short end and then pull your hands again towards opposite sides. Always pull your hands toward the opposite sides.
Oh, so we kind of have to double knot it. Like when you're tying your shoes and you don't want it to kind of unravel, this is the technique to make it really hold. Just once though? They always look like such a mess after my surgeries.
You want to keep doing this until you have at least 4 or 5 throws.
Aha! So we need 4 or 5 knots before moving on to the next stitch.
The way to do the cutting, once you have the strings in your hand, is you want to go and then angulate a little bit. Once you get the scissors in, you want to angulate a little bit because that'll give you a little bit of room so that you don't cut the strings too short.
Okay, I'll angulate. What is this even? All right, so now that we have the main one here, we're gonna do it again. So we do 1 twirly like this, grab the wire and pull. Oh my god, I keep making a loop. How did he not make a loop? There's 1. Here's another loop. Oh my gosh, this is wrong. Hang on, I got this. Okay, there we go. This way. Stay that way. Stay that. Stay. Don't get into the wound. No. Stay. Okay, don't worry. I got this. Okay, so another loop. 1. I'm gonna try and pick as far to the end as possible. Yes! There we go. Now we have 2. That is a mess. No, that is not gonna heal well. You're gonna need polysporin. Oh no. Okay, let's try again. Let me close this off. I'm gonna do 5 knots and then we'll do the cutting. All right, so obviously this is not done right. So for those of you who wanna say,
The jacket needs to be tighter, you're doing it wrong.
I agree. So yeah, there's definitely too much gap. My guesses, if I had to say how I did it wrong, is I didn't take enough of the skin to fold it closer and my tension was completely off. So let's try and grab more tension and then level up the kind of suture we're gonna do. And yes, don't worry, I have ketchup. I didn't forget the ketchup. All right, so here they are. Take the scissors and angulate and snip. Voila. You know what? This kind of looks like the ones I've had. No wonder my scars are so big. Let's try this again. All right, so we're going to go a little further this time to have a good, as Dr. Mario calls it, a good bite. And we're gonna go a little further than we did last time. So last time we were too close to the edge. Let's go a little further up. Oh, too far? Oh no. Okay, yeah, that is way too far. We're not going there. Hang on, I'm sorry, person. I think right here is about a good distance. Okay, there we go. And the good thing about this is your patient is sleeping for the most part. All right, so I think this is a pretty good bite, as doctor would call it. And from here, oh, wrong scissors. Wrong thing. This. All right, we're gonna do the 2 knots, 1 wrappy, 2 wrappy, and pull through. Very nice. That looks good. I'm pretty sure I angled it wrong. Let's put this way. That is already much better. And then we're gonna do solo. That's 1. Grab the thread and pull through. Oh my God. Oh my God. That is way better. Look at that. So I think I took too much skin this time, but much better. We don't have that gap that's just going to make it leak on the outside. All right, let me do a couple more and let's see what that looks like. Here's my second one, and I have to say it looks much cleaner already, but I think the gap between these two is basically too big because we have a little bit of a pudge that's kind of open over here and we do not want that. So I'm gonna make the next one much closer and we'll see if we can get this gap in between to actually be closed. By the way, for someone like me who hates sewing, I'm telling you, I hate sewing, this is actually really relaxing. It's probably one of the best fidget toys. I know it sounds weird, but this is a really relaxing fidget activity if you don't want to be fidgeting all the time. All right, so let's make the gap here smaller. So we're gonna take it a bit closer. Not too far, not too far. Nope, too far, nope. There we go. I think this is good. It's actually really relaxing to do. It's almost like a guided activity. All right, so 1 turn, 2 turns, grab and pull. Let's see how that looks. Even though I haven't done all of the turns, yes! Oh my God, you can't even see the gap. Look at that. So we have to make sure that it's much tighter to not have that gap in between. I am loving this. Okay, maybe my dad, no, you know what? No, there's no ketchup that I have to deal with. No, I could not deal with this. So no, I'm happy with it as a toy. I'm glad I'm not a doctor. Okay, I'm glad we have this. Now let's do something more challenging. I've just shaved off 2 years of med school, so we're on our way. Honestly, Grains, this here is making sewing so much more interesting and fun because, you know, you don't have to worry about the filament. But yeah, this one is kind of just like a fishing thing. Before we do the next stitch, let's take a look at what these look like. So this is polypropylene. And it kind of looks the same. That is so weird. I'm pretty sure they're different. But to someone who has no idea what's going on, these are exactly the same to me. So this is the orange packaging. First one we opened is the green one. Purple. This one is polyester braided. I'm just gonna shortcut my way. Oh, this one is green and it has this cloth type look, and yeah, the feel is very different. Unfortunately, they don't say what each type of filament is for in those tutorials, so I'm guessing that's something they can add to their own website. And now we have the silk braided. This is a blue one. And, all right, we can't tell yet, but, oh, a black string. Very nice. And what does it feel like? It also has this cloth type feel. Interesting. So we have 2 that are cloth-like and 2 that are basically like fishing wire kind of thing. There. Unfortunately, they also don't tell us what each of these kinds of cuts would be for or in what scenarios they could be seen, but I'm guessing that's why I would need the other 5 years of med school. I guess you can't have it all. So let's go ahead and use this one, and we're going to use a different kind of stitch. According to Dr. Mario, is called a running stitch. It's basically the same concept as the individual ones that we've done so far, except we don't stop. We keep going from one end to the other and then knot it up. But he does explain that the bad thing about it is if you lose at any point, if the wire snaps, you have to start all over. So that's the downside. But I'm wondering how often it would happen. I guess we'll find out. Which means time for ketchup. Let's see how I can avoid getting my hands dirty with the ketchup in the wound. All right, so let's get a little opening. Okay, let's just go ahead and put the ketchup in here. Spread this open. We're gonna put some ketchup right in there. Because, I mean, come on, we need to be as realistic as we possibly can. I am a professional doctor, and I know exactly what I'm doing. There we go. Oh, I think that may be too much. Oh my god. Okay, there's a little bit of extra ketchup. Let me just do this here. I like ketchup. Okay, let me squeeze a little bit of that out. And I think we're ready. Since I have no idea what the differences are with the sutures, I'm going to take the orange one because it seems to be the most waterproof, and we do have our ketchup nicely in there. So let's see how that's gonna look. I love realism. I have goosebumps now just thinking of the ketchup. I am not made for doctor things. All right, we ready? Okay, let's try that again. Aw. I'm very mature. Quite very mature. There we go. All right, so let's go ahead and start from here. Get some nice clean ones. Just so you grains know, I'm trying to do this through a screen. The other sutures that I did well were actually without the screen. So, okay, let's keep going. Let's keep going. Okay, and here. Oh my god. There we go. And pull. And now let's go ahead and do our 2 loopies, our surgeon's knot, and then grab from the edge like so, and pull. Right, there you go. Yes, that looks good. And let's make a couple of knots. He did say about 4 to 5, so let's keep going. Voila. And you know what? The ketchup hasn't reacted yet, which I'm pretty surprised. I'm pretty sure that's not how it works, realistically speaking. Or maybe it does, I don't know. Does it just flow freely? I don't know. I'm not sure. All right, let me make the other 3 to 4 knots over here. And now we angulate and no. Okay, no, I'm not supposed to do that. I'm gonna do that only to the short one over here. And then we have to continue. Oh my god, I almost really messed that up. We're supposed to continue sewing all the way. Oh my god. I seriously almost done messed up.
You done messed up, Aaron!
All right, so from here, it's basically just taking even little bites. Well, not little, but even bites. That ketchup, oh, it's really, I'm not having this. This whole ketchup situation is just not great. Believe it or not, it's actually making me nervous. All right, so we have here and right. Oh my god, what's going on here? There. That is hilarious. I am way more nervous with the ketchup being there than with it not being there. Holy carp. Okay, like this. Voila. Very nice. And the doctor did say to keep a tension as we're going. So I kind of have to keep my hand holding over there as I'm putting the next one in. So let's go ahead. Oh my god. Oh my god. I got you. There. Good. We're keeping tension. Yes. Yes. Okay, we're doing good. There. This is weird. I thought his looked different.
Yeah, maybe it looks different because it's actually better.
Stop. I know. This is so weird. I could have sworn it was the same technique, but it looked better. Here's what his looks on the screen. And this is what mine is looking right now. Let's see if it changes as I go and make more sutures. Oh my god, thankfully this is not a real person. Can you imagine all the little nicks they would have just because I'm trying to get through? There we go. There we go. Very nice. I'm keeping the tension, and voila. But yeah, I think I really like this method quite a bit. This needle is excellent. The fact that it's curved makes this amazing. Oh no. Oh, ketchup. Oh no. I feel like the ketchup wants to come up because at this point we're making it go further and further into the other side. But hopefully that's not the case. This is harder to see. Now that we have ketchup there, I can appreciate the fact that it is a little more challenging to see where this is going. This is really botched. Like, I like this technique, but it looks ugly. Like, really bad. Is this what it looks like in the video?
And now I actually grab that loop that remains and I pull down on it. And I'm going to use that loop as my short string to be able to tie off the running suture.
Oh no. Did I mess up? No, I didn't mess up. It does still look ugly. I can see why it's probably not used as much. It's just ugly. So we won't keep going. The ketchup in the way. Oh, ketchup. This is not pleasant at all. I was like, this is so relaxing. No. It is not. I feel like I'm trying to rush into doing this because the ketchup is making me nervous. All right, we are nearing the end here. And I don't know, what do doctors use to wipe off human ketchup? Do they use paper towels like I'm using right now? Or are they using some form of alcohol wipes? I'm not sure, but this is such an ugly suture. Oh my God. Oh no, we have the ketchup coming out on the other side. And here I am using paper towel. Oh my God. This Frankenstein's monster here. And let's get that edge. Whoops. That was no good. You didn't see it. Okay, replay it. Whoops. Yeah, whoops. And then grab this and pull through. Oh my God. There. Oh my gosh, come on. Yes, we got it. Okay, we wrap this up. Let me do 5 more knots so that it's secure. And now we angulate and snip. Voila. Yo, but me good. Here is the running stitch that I did. It is by no means pretty. It is uneven. It's for sure a stitch I haven't seen on myself. I'm 100% certain that my surgeries basically had the first one. And I'm really proud of myself for having done a nicer looking stitch with the non-running stitch. Even though it's ugly, it is holding ketchup in. We had barely any ketchup escapage. That's a good sign. You want me on your support team during the zombie apocalypse. So for only a short payment of 15 payments of $135.99, you can have your own support nerdy on your team. We will make it through. Let me know what you thought and if you've ever had any kind of experience playing with this kind of stuff. Very relaxing, very satisfying to see what it looks like because it kind of does look like human skin. If you want to watch my previous adventures in piercing, check up here. Or if you want to see me tattooing for the first time, make sure you check down here what adventures we go on. Until then, I will see you grains in the next video.